Biologics or monoclonal antibodies targeting specific inflammatory markers have revolutionised the treatment of severe uncontrolled asthma and severe uncontrolled chronic rhinosinusitis with nasal polyps. The choice of which biologic to use, though, can be quite complex, with a range of factors to consider, including the presentation of the patient, symptomatology, disease markers, and geographic location. But help is at hand with the brand new EUFOREA Pocket Guide on Biologics. This is EUFOREA News. Hello and welcome to EUFOREA News. I'm Dr. David Bull. Since the last decade, treatment of patients with severe uncontrolled asthma and or severe uncontrolled chronic rhinosinusitis with nasal polyps has been, well, revolutionised. The game changer has been the advent of biologics or monoclonal antibodies. Now, several biologics are recommended in the International Guidelines of Care of Asthma and CRSwNP, but this area is complex. Physicians dealing with severe airway inflammation are not always aware of which biologic is indicated for each condition and what they should consider in a specific patient with severe illness. Therefore, riding to the rescue, EUFOREA has now come up with a new pocket guide for biologics. Its aim is to guide physicians through the jungle of available biologics for both conditions, for asthma and CRSwNP. It also highlights the similarities and differences in biologics used for both conditions. Well, here to tell us more, I'm delighted to be joined by Professor Witske Fokkens, a professor in otorhinolaryngology at the Academic Medical Center in Amsterdam. She is also EUFOREA CRS EPOS Chair. Really good to talk to you once again. Thanks ever so much for joining me. Let me start by asking you, why did you feel there was the need to develop a pocket guide on biologics for CRSwNP and also for asthma by EUFOREA?
Well, thank you very much, David, for that question. I think that's really relevant to emphasize how in need healthcare professionals are of combined knowledge on chronic rhinosinusitis and asthma in the context of treating with a biologic, because most of the patients that actually need a biologic have both diseases. Most patients with chronic rhinosinusitis with nasal polyps have asthma, and a considerable part of the severe asthma patients have chronic rhinosinusitis. So in general, patients are usually treated in collaboration between otorhinolaryngologists and pulmonologists, sometimes also allergologists. So in that sense, it's very important that we talk a lot together and that we have the same start to talk with. And for that reason, I think this pocket guide is great, that we all use exactly the same material to treat our patients.
So I said at the beginning, it's kind of a jungle out there about which biologic to use when. How do you think this pocket guide will help primary care and also secondary care physicians dealing with both conditions?
In general, I think biologics is not for primary care. It's really secondary, tertiary care treatment for very severe patients that need such a expensive treatment. But for those in secondary and tertiary care, the choice between all the different biologics is very complicated. And at the moment, we have limited knowledge about which biologic would be perfect in a certain situation. We have very little biomarkers to help us. We have a little bit of knowledge that in situations where there is both upper and lower airway, some biologics seem to be more effective than others, but the whole field is still evolving very, very fast. So this is a today knowledge fully up-to-date knowledge about what is available in this pocket guide. But it will also change in the coming years for sure.
Can I ask you, what do you like most about the new pocket guide?
Well, I really like about the pocket guide that it is on one hand very basic. It really defines the different diseases. It very shortly points to the different management schemes and also gives us QR codes to more extensive other pocket guides on, say, treatment of chronic rhinosinusitis or the treatment of asthma. But it now so nicely then combines all the knowledge available on the combined respiratory disease and how to best treat, and looking from different angles, looking from the upper airway and from the lower airway angle, and coming to a combined management protocol.
I mean, this is a rapidly moving field. How often do you think this pocket guide will be updated in the future, given that dynamic landscape of biologics?
Yeah, that's a very good question, and nobody can look into the future, but I expect we will have to regularly update this pocket guide, and probably maybe even in 6 months or a year, we will need to update because it's such a fast evolving field, and the new knowledge is coming in almost every week. So this is the up-to-date of today, but it will not be the up-to-date of next summer.
Well, always such a pleasure to talk to you. Thank you very much indeed, Professor Witzke-Fokkens.
It's a pleasure.
Well, joining me now is Professor Dame Valerie Lund. She is Professor Emeritus of Rhinology at the Ear Institute at University College in London. She's also Honorary Consultant ENT Surgeon at the Royal National Throat, Nose and Ear Hospital, also in London. Really good to talk to you once again. Let me start by asking you for your thoughts, please, on the new pocket guide by EUFOREA. Why do you feel there was the need to develop the pocket guide? Just following on from the interview I did with Professor Fokkens, why did you see the need to have this pocket guide on biologics for asthma and also for CRSwNP?
Well, obviously, I speak from a position of bias because I'm part of the group, but I think it was an excellent idea, a great initiative, and it's really a wonderful example of what EUFOREA stands for and what the organisation can achieve. I mean, looking at it sort of from a historical perspective, with the advent of intranasal and inhaled corticosteroids in the 1970s, and then we had endoscopic sinus surgery for ENT surgeons in the 1980s. But I mean, arguably, the advent of biologics has made, potentially one of the biggest changes to our management of chronic diseases like CRS and asthma, again, in my sort of career. And it's certainly something which has provoked enormous interest across the world. And consequently, there have been numerous position papers and consensus documents and guidelines, of course, all been updated in response to the various studies as they've come out. But what this document does, and I think it's very timely, is it gives us something which is accessible and which is easily digestible as a distillation of the present situation. And I think that's a really sort of timely event.
Why did you put both the upper and lower respiratory tracts together in the guide? Clearly there was methodology behind this.
Well, we've been talking about the united or global airway for decades now. I have to say there's been varying degrees of support from ENT and pulmonary physicians. But I mean, one can, I think, make a very good argument that the respiratory tract is one organ, both from a physiological and a pathophysiological aspect, certainly with respect to CRS and asthma. It's something which, we as ENT surgeons, have always been happy to collaborate with our chest physician colleagues because, we've got so much from them over the years. We've got many concepts from them, things like phenotyping and endotyping, or the idea that we need to achieve control in chronic diseases like CRS. And of course, we've also taken on board many of the medications developed for the lower respiratory tract. the topical corticosteroids and now the biologics. But I mean, above all, I think the most important message here is to emphasize and foster a multidisciplinary approach, because that really gives both the patients and the doctors who treat them, huge amounts of benefit. And you can argue that the biologics have really given us an opportunity for a holistic approach to the treatment of the whole respiratory tract. And for that, I'm very pleased.
And just in terms of the pocket guide, who are you aiming this at?
Well, I obviously heard what Professor Fockens had to say, and clearly this is treatment, biologics are treatment which will, largely be given in tertiary care, certainly above secondary care. But, at the end of the day, anybody who is interested in the management of CRS and asthma would find this document of benefit. I mean, clearly, ENT surgeons, those with an interest in the nose and sinuses, and chest physicians. But I think, there is a large group of primary physicians who might find this of interest, nurses, of course, and indeed even physician assistants, and anybody who deals with CRS and asthma. And above all, there will be motivated patients who will want to know the information that is in this document. So I think it's a pluripotential educational document.
Well, it sounds absolutely brilliant. In terms of the pocket guide itself, does it mainly address type 2 inflammation? And also in terms of nasal polyps, are all nasal polyps, do they tend to be type 2 dominant?
Well, by the nature of the conditions that these present drugs have been designed for, we're mainly addressing type 2 disease. But I mean, we know that in Europe and the USA, for example, the majority of polyps do tend to have a eosinophilic predominant T2 type disease. About 85% of patients fall into that group. But as we move sort of eastwards to countries like Japan, Korea, and China, we see that endotype becomes rather less common. We see perhaps less than 50% of the patients with polyps there have an eosinophilic type 2 predominant endotype. What's really intriguing is that in Japan, there have been longitudinal studies showing that predominance is actually shifting towards a more eosinophilic picture over the last couple of decades. And that really is very intriguing. Then, of course, we've got patients with cystic fibrosis who have a significant neutrophilic profile with their polyps. So that may just be likely a reflection of the bacterial impact of things like Pseudomonas in that disease. The other thing that's, conversely of interest is that if you look at patients with CRS who don't have overt polyps, we know there are studies showing that a significant proportion of them can also have a type 2 predominant endotype. So that has quite significant implications for the use of biologics going forwards. And it really emphasizes the importance of really thinking carefully about what disease our patients are suffering from, what endotype do they best fit into, and also, then we can individualize the treatment that we give them.
Well, thank you so much. Both of you have convinced me now this is essential bedtime reading. Thank you very much indeed to Professor Dame Valerie Lund.
Thank you very much.
Well, that's it for this EUFOREA news. Many thanks to my guests, to Professor Witzke Fockens and also Professor Dame Valerie Lund. Now you can find more information about EUFOREA and also register for the EUFOREA educational events on the euphorea.eu website, where you can also sign up to receive the latest news via email. Also, we are on social media. Do follow us, please, on YouTube, X, LinkedIn, Spotify, Instagram and Facebook. Until next time, goodbye.